Welcome to Dr. Dean's bonus video titled Cutting Costs by Killing Patients. Americans all complain about our healthcare system. Insurance is unaffordable, the cost of care is unthinkable, and despite all that spending, care itself is unavailable. Some people advocate federal takeover of healthcare called single payer or Medicare-for-All or universal healthcare. They claim that Washington can provide all the care we need while simultaneously eliminating our out-of-pocket costs. So, how will they accomplish this magic? The answer is government medical rationing, both direct and indirect. The government can ration your care directly by deciding what treatments the bureaucrats will authorize and which treatments we can't have. The criterion that government uses is cost effectiveness, not medical effectiveness. With government-controlled healthcare, the budget dictates your care, not your medical needs. Washington can ration your care indirectly by limiting the number of medical facilities and personnel. That is why single-payer countries like Canada don't have enough operating rooms or burn units and people die waiting for care. The result of medical rationing, both direct and indirect, is called death by queuing, where patients die waiting for care that is medically possible but not available in time to save them. Our soldiers back from the battlefield were also victims of death by queuing, according to an internal VA audit, which said, and I quote, 47,000 veterans may have died waiting in line for care. Here's more proof of death by queuing with government health care, such as Medicaid. Nick Horton reported that 752 people in Illinois eligible for Medicaid died while waiting for care that just never came. And then, of course, there's the tragedy of Diamante Driver, a Maryland 12-year-old boy who died from complications of a tooth cavity, a dental cavity. There were no pediatric dentists in his area who would accept Medicaid patients. The key takeaway message is this: someone has to ration medical care. The word ration comes from the Latin ratio, meaning to reckon or to calculate. To ration medical care means to establish a balance between supply of people and facilities with patients' demand for medical care. The big question is who should do the rationing? Who should decide spending and care, the government or you? If the government rations your care, it will be determined by a bureaucrat based on the federal budget and not your medical needs. By cutting costs, Washington will actually kill patients through lack of care. As I said, this is known as death by queuing. If you ration your care, you can have affordable, readily accessible medical care. It's that simple. And okay, I can just hear you now shouting, wait a minute, I can't possibly afford to pay for my care. I am here to tell you that with states' care and market-based medicine, you can afford the care you need, and you can get it when you need it from a doctor whom you choose. For proof this is possible, check out my new book, Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine. It's a quick, easy, and surprisingly enjoyable book. If you have not already subscribed to the website, We Can Fix Healthcare, go to deanwaldman.com. That's Dean with an E. My mother did that to me 76 years ago. Just click on the blinking icon on the top right. There is no charge to access any of the bonus materials. And encourage your friends and neighbors to subscribe as well. Finally, be sure to subscribe to my YouTube channel to view the latest videos. Just click on my image on the screen to your right. So thank you for watching and for being part of the cure for our sick healthcare system.